So this discussion is focused on your colostomy care. So recall earlier that when I talk about colostomy, guys, you're referring to that stoma, you're referring to that artificial opening created in your colon, which would act as the passage of your gas, it could act as a passage of your feces, okay, your fecal matter. Now for this discussion, our focus is the following learning outcomes: to discuss the expected and unexpected findings in the stoma, in other words, the normal and abnormal, and to demonstrate proper stoma care. Now, class, the rationale for colostomy care, you might be thinking, why do I need to clean the colostomy? That's poops, no? So that's dirty. Why do we need to clean it? So one, class, the fecal matter is considered irritating to the skin. It contains acid, it contains products from the GI system that would be irritant to the skin. Second, we need to regularly clean the area surrounding the stoma. And then class, third, we need to remember that fecal drainage would occur 3 to 6 days post-operatively. What do we mean by that? If my patient's stoma has just been created, we do not expect that the patient's feces would be coming out right away. How come? Class, immediately after surgery, is the GI function already optimal? Is the GI function already normal immediately after surgery? Class, if you would think of it, no, the functioning of your GI system is not yet optimal immediately post-op. Why? You placed your patient on NPO. You had a gastric surgery. You cleaned the bowel of the patient. And for some 24 hours or so, your patient would not be able to eat because you're waiting for your gag reflex to occur. You're waiting for your bowel sounds to occur. So do not expect that there will be an output in the stoma within 3 days. Okay, within the first day post-op to third day post-op. Why are we telling you this? Because oftentimes class patients after surgery would say, "Oh, bakit ang stoma ko is not working?" They will be wondering because they thought that their poop would be coming out the stoma, but here comes after surgery, there's no poop going out. So remind them that they were not able to eat yet. And for that reason, class, the stoma is not yet working. Now, you have the normal findings post-operatively. Class, you would expect the new colostomy stoma to be red. You would expect it to be edematous, but the edema would decrease in time. Plus, the edema is somehow related to the inflammation because you did an instrumentation, the doctor touched that area, hence related to inflammation. Next, class, the normal stoma color is playing between red or pink, and the red or pink color, class, actually indicates high vascularity. In other words, the blood supply is adequate going to your stoma. Now, class, once the stoma becomes pale pink, that indicates that your patient has decreased hemoglobin and decreased hematocrit levels. Now, if your stoma, class, would have swelling, color changes, discharges and bleeding, you need to report that to the doctor. Why? If there is swelling, especially 5 to 7 days after post-operatively, guys, that would indicate that there is some infection occurring in your stomach. If day 1 and there is still swelling, do not be alarmed because your patient was just operated. So you would expect that there is a problem on the swelling. There may be some swelling. But after 5 days, if your patient's stoma is swelling, oh no, no, no. That's not a good sign. Next, for the PPE, you need to wear your goggles, your mask, your gloves, and gown. Why, class? We are anticipating direct contact with the fecal matter. And part of the contact precautions, when I say contact precautions, diseases can be transmitted by touching, class, that part which is infected. Okay, so you need to have your gown for your contact precautions. Then you can use your face shield. Now, this is even without the pandemic. Okay, this is even without the pandemic. Especially if we are expecting that the excreta or the output from the stoma would be very wet. Okay, now, you need to empty the pouch when 1/3 full or emptied every 4 to 6 hours or the same time of bladder emptying. Take note of that, class, 1/3 full. If you would look at the stoma, you do not wait for the stoma to be full, as in very, very full, before you would get it out or before you would replace it. Why, class? Once it's full, the fecal matter would leak on the patient's skin. Once there is leakage of the fecal matter, class, this would increase the risk of your patient for excruciation. In other words, class, there is a possibility that the skin of your patient would be eroded. Now, why do you think, dear students, do I need to do this at the same time of bladder emptying? What could be the reason why we are doing this at the same time of bladder emptying? So, class, this is done during the time of bladder emptying to mimic the natural environment for emptying of your colon. So, to mimic the environment, class, wherein you are defecating. For the same reason, we are teaching our patient to drain the colostomy, let's say, for example, every morning. We also inform them that they need to defecate regularly in such a way that if they are working, they will not be disrupted along the day if they have established their bowel schedule. For example, if my patient is working at 8 a.m., I would suggest that, sir, it's better for you to do colostomy care, colostomy irrigation at around 6:30. In such a way that from 8 a.m. to 5 p.m., there will be no output that you need to drain. Okay, or at least the output would be minimized because your patient is in their household. That would be a convenient time for him to do his colostomy care. Okay, take note of those things. Now, ensure that the size of the skin barrier used is appropriate and it would hug the stoma up to the stoma but not touching the stoma. What do we mean by that? Class, if this is the stoma of your patient, meaning that's the hole on the abdomen of your patient going towards the colon, the colostomy bag tape must be somewhere around here. Okay? Meaning, class, it's very near the stoma but not touching the stoma. The purpose of that, dear students, is that by the time that the fecal matter would get out, it would automatically be captured by your colostomy bag, but without harming the skin surrounding your stoma. Because you also don't want the fecal matter to come in contact with the skin. For that reason, you need to drain this one once it's 1/3 full. Now, what are the nursing responsibilities also that you need to teach them? One, avoid gas-forming food. Okay? Avoid gas-forming food. A very good example of that is your peanut, your nuts. Why, class? If they are having the gas-forming food, of course, class, a lot of air, a lot of flatus would be going out. Second, you have your intestinal deodorizers. What do you mean by intestinal deodorizers? Pag ito yung kinakain ni patient, class, medyo mabango at medyo kaaya-aya yung mga hangin na lumalabas. Okay? It makes the air, it makes the flatus more palatable. So, class, you have your spinach and then your parsley. Now, other causing food, best food that they need to avoid. Again, the food that they need to avoid. Asparagus, cabbage, onion, and fish. These are producing your heavy flatus. And plus, you have your stool thickeners. Rice, mashed potato, and then you have your applesauce. In our setting, of course, rice and mashed potato are very more common compared to your applesauce. Sir, what do you mean by stool thickener? As the term implies, it makes the stool thicker. Because your problem in colostomy is that, what is the consistency of your stool in colostomy, dear students? These stool softeners would be able to help your patient, class, in order to maintain the consistency of the stool. Because as mentioned, it is the stool in the ascending colon or the fecal matter from the ascending colon colostomy is more wet compared to that in the transverse colon and then the descending colon. Now, let's review the procedure for your colostomy care. Of course, you'd gather all the equipment, encourage the client to look at the stoma. Why do we need to encourage the patient to look at the stoma? It will give them acceptance. It will promote acceptance of the stoma. Dear students, if I'm talking about stoma, if I'm talking about, for example, mastectomy, if I'm talking about colostomy, one nursing diagnosis that is most common among this population is what you refer to as your disturbed body image. They would have disturbed body image. And when I talk about disturbed body image, students, they would have a tendency not to look at themselves because they think that they are not who they were before. So there is disturbed body image. So you need to encourage them to look at the stoma. And then while they are still in the hospital, involve them in cleaning of the stoma. Even if the patient, class, is a bit hesitant to do it, try to include them, class, during the cleaning or during the irrigation of their stoma. Why is that so? If you will not be involving them, class, later on at home, they would have difficulty to do it. They would have a very big difficulty on doing it. Next, explain the procedure to your patient, then you provide privacy. The best position actually for your patient during this one is either standing position or sitting position. I would usually say sitting position because that mimics the defecation process. Then you perform hand hygiene, then you wear your gloves. And then class, you determine the need for a change of appliance. So class, the change of appliance is recommended if again the colostomy bag is 1/3 full. Next, you need to inspect the ostomy, that hole, and observe the color, swelling, trauma, and healing. Now, class, there are different types of discharges that may go on in your stomach. If I say that your patient is 2 days post-op and you're seeing serosanguinous secretions, normal or abnormal? In that case, class, that is expected. That is expected. Now, if I am seeing purulent discharges 5 days post-op, normal or refer to doctor? Very good. In that case, class, you would need to refer to the doctor because purulent is it's a sign of infection. Okay, it's a cue to you that's a sign of infection. How about if I saw the stoma to be pinkish at 3 days post-op? Expected or refer to doctor? Okay, that is considered to be expected. That is considered to be expected. Now, you need to spread the rubber and the draw sheet if ever your patient, class, will be on lying down position. Okay, you need to spread the rubber and draw sheet because that would allow us to prevent spillage to the linens of your patient. Then you remove the use pouch and the skin barrier gently by pushing the skin away from the barrier. So what do we mean by that, class? If this is where the stoma of your patient is, okay, if this is where the stoma of your patient is, and this is the skin of your patient, class, here, you push the skin backward. Okay, it's not the usual wherein what we do is we pull it forward. We are not pulling the pouch forward. Instead, we are pushing the skin backward. Okay, we are pushing the skin away from the barrier while we are holding the barrier. Plus, this, according to research, could reduce the risk for erosion on the skin. Then you discard the disposable pouch in a paper bag. Plus, in an actual hospital setting, what we would sometimes actually do is first to pour, class, the discharges in the toilet bowl so that during the disposal, it would not be much of waste. No? Okay, but ideally, of course, you should be disposing it right away. Okay, class, just for you to be aware, in the hospital setting, the waste products are being weighed, as in kinikilo po natin siya para malaman kung gaano siya kabigat, and that the company will be paying depending on the amount of waste in kilograms. Okay, that's why, class, we are trying to reduce our waste products. Now, you also, next, observe the stoma still for the color, swelling, trauma, and healing. Then cover the stoma with a gauze piece. Then, class, you clean the peristomal region. And class, when you are cleaning the peristomal region, you use warm tap water using gauze pad. Okay, warm tap water using your gauze pad. And take note, when you are drying, class, any part of the body, we do not rub the cloth. Instead, we pat the skin dry. Rubbing the cloth, class, would increase the risk for decubitus ulcer. Other than that, it leads to lacerations also. Now, you measure the stoma using a measuring guide and trace the same circle behind the skin barrier using scissors, but an opening of 1/16 to 1/8 larger than stoma before removing the wrapper over the adhesive part. Sir, what is that talking about? So class, in this case, no, if you have your stoma, dear students, what happens is that you need to measure the stoma, okay, for you to have that adhesive device or adhesive apparatus. So for your stoma measurement, dear students, what happens is that you need to trace the circle behind the skin barrier and you use your scissors to cut it open. And now it has given you a guide that it should be 1/16 to 1/8 larger than the stoma. Again, class, 1/16 to 1/8 larger than the stoma. Diba earlier, na-mention natin na dapat it should be close on the stoma but it should not be touching the stoma. So the guide is 1/16 to 1/8 larger than the stoma. Then you need to remove the adhesive backing to expose the sticky side, and then place the skin barrier over the client's abdomen, okay, or over the client's skin, I mean, and press for 30 seconds. Okay, what's the purpose, class, of pressing for 30 seconds? It's just putting a little pressure in such a way that you will be assured that the stoma will stick. Okay, to be assured that the stoma will stick. Now, okay, class, on the next one, you need to put the pouch over the stoma. You stop the pouch onto the skin barrier wafer and gently press to the skin for 1 to 2 minutes. Then you need to remove your gloves and wash hands, make the patient comfortable, then clean the area, and then replace. When I say replace, class, return them to their own containers, and then record the procedure with the following details: date, time, amount, color, consistency of fecal matter, and signs of any infection. Now, these are the references for these slides. Thank you very much for your attention.